and welcome back to another episode of the Association Spotlight Series. Today we have a new guest from the Eastern Panhandle, and with Stephanie Props here. If you could just tell us a little bit about yourself. And again, thank you for joining us today. And I know you're busy, but yeah, if you just want to let everyone know who you are and what you do.
Okay, absolutely. My name is Stephanie Props. I live here in Berkeley County in the Eastern Panhandle. I'm 38 years old. I have one son. Currently, I serve as the agency compliance officer for EastRidge Health Systems. That's located also in the Eastern Panhandle. I also serve as the agency's privacy officer, medical records supervisor, and system administrator for our medical records. I'm sorry, you have to change it for our electronic medical records. And that's pretty much it.
Wow, great. Yeah, it sounds like you wear a lot of hats over there for sure. Yeah, that's great. And so again, how long have you been working at EastRidge?
I have been with EastRidge for 16 years in various roles throughout the company, and served as the agency compliance officer for about the past 9 years.
Oh, okay, great. Could you tell us just a little bit about your first position at EastRidge or in behavioral health?
Sure. My first position here at EastRidge, and this is my first position in behavioral health, was actually at the front desk. I was the person that kind of checked in folks as they came in, and just kind of have moved up from there.
Great. Did that just kind of happen randomly, or did you have any interest of going that route toward the behavioral health world, or just did it kind of just work out for the best there and then found out you really liked it?
Well, initially, honestly, someone told me about the position, and directly or indirectly, I think that mental health and substance abuse affects everyone. So when I came into this field, I was looking for stability. It seemed like something, that folks would always need this type of service. And as you, move in positions and kind of get acclimated to the position, you kind of want to stay, and you find that you have a knack for that customer service, or, caring for people, even if it's indirectly, behind the scenes administratively.
Yeah, absolutely. So you really, it seems like you've seen the ins and outs of the world and the industry, especially at EastRidge. So how would you think that where you are today, starting where you started and seeing all the different perspectives, how do you think that's kind of helped you get a good understanding and footing of your position nowadays?
Well, I think, anyone where they work, being cross-trained and, being able to help out in multiple departments is, pretty key to being successful in a position. I know what it's like to be in those positions. So when issues arise, or, someone needs assistance, it's really easy to jump in, or, provide that guidance that they require, as I am the agency compliance officer, to be able to assist in that.
Yeah, absolutely. What do you love most about your job, or would you say that you enjoy the most up at EastRidge?
I feel that we have a really good team here, professionally, administratively, and our direct care staff. I think that everyone that I work with really is in this field for the right reason, enjoy, assisting people, whether it's direct care or behind the scenes, that kind of thing. I enjoy the folks that I work with, as far as we've kind of got like a family atmosphere, that sort of thing. And I enjoy the day-to-day, in the mental health and substance abuse field, you do run across a lot of troubleshooting and, putting out fires, so to speak. And every day is different when you work in behavioral health.
Yeah, absolutely. It's ever changing, and no day is the same, it seems, right? So, are there any stories that come to mind? Again, just things that you really it seemed fulfilling, the things that you've seen come through EastRidge that again kind of remind you of what you all are there to do, and things that just make you feel good, I'm sure.
Well, sometimes it's small steps. What seems small, what could be a big accomplishment. A lot of our folks in the Suboxone program, they have celebratory marks, as far as sobriety and things like that. And then we have case managers who work with folks to, find them employment, housing. So, you can kind of see the rewards of the field in those aspects. And then even on our IDD side, as our direct care are working programs and taking care of consumers, that you do get direct feedback by, the smiles on faces and that kind of thing. So.
Absolutely. Oh yeah.
Yeah.
That's great. So Stephanie, what would you say to someone maybe wanting to pursue a career in behavioral health? Very interested in the field and maybe a younger person looking to get into it. What kind of advice would you have for a person like that?
I would say, that, if this is something that, if this is a field that they feel strongly about and, they're passionate about taking care of folks, whether it's directly or indirectly, that they should really give it a try. You can start out at an entry level position, so don't feel discouraged by that. And you easily work your way up, into different positions throughout this type of field. And we have folks all the while who in the background may be working on their master's or bachelor's degree and, use those entry level positions just as a foot in the door. If you feel passionate about taking care of people and, really, really want that rewarding experience, then behavioral health is something that I would definitely recommend.
That's great. Yeah. Well, thank you so much, Stephanie. I appreciate your time today, and we look forward to hearing from you sometime soon.
Okay, absolutely. Thank you so much.
Thank you.